March inward here, what do you feel in your low back there?
Stress.
He's feeling stress already. He's in a reverse C position and he hasn't even started his golf swing. So we want to see that tail tuck a little bit, so now we've got that position. That's why I gave you guys the drill of the club on the spine. Okay? Good. Pain behavior, what feels better, what feels worse? As I said, people with discogenic pain, they don't like to be in flexion a lot. Tying their shoes in the morning. I mean, just looking down at them is hard enough when you've had a back episode, right? I mean, the thought of even putting a sock on is hard. Neutral pelvis. This is a neutral pelvis. We're going to see this person have very good symmetrical hip range of motion. Why is that important? Ball and socket joint, great for rotation. Back, not so good for rotation. So I want maximum rotation through the hips. As I said, treatment strategies are different for each one. Customizing a strategy for you. For Jason's going to be different than John or RC or any of the rest of you. It's got to be customized. We already covered this, what makes you worse. Flexion is rounding forward, bending, stooping, lifting, sitting prolonged. Extension is going to be the standing ones. Being in the kitchen a long time. Typically one is going to feel better. And one's going to feel worse. For those of you, how many of you have had episodes where it was a result of something bending forward and lifting where you tweaked your back? Okay? The most simple thing in the world. We like to treat people by teaching them. I don't like to have you come into the clinic 3 days a week for 9 weeks. I'm not empowering you if I'm doing that. I want to teach you how to do this. So I tell the person, okay, if it's that behavior, go ahead and lay on your stomach like that guy and just relax there for a few minutes. Maybe not comfortable in the beginning, but what happens after a while? Well, he says the pain starts to diminish and that spasm that starts to let go. Okay, let's go up on your elbows. Well, what are we doing if we go up on the elbows? Let's go back to our Oreo cookie example. If I've distorted some of that cream filling or disc material to the back, what do you suppose is happening when I'm going the other way? Theoretically, maybe I'm pushing it back toward the front. Now, whether or not that's completely true, I don't really care. If it worked and you got out of pain on your golf trip because you grabbed your bags off the luggage carousel and tweaked it, good. Now, if you're the person that tends to have that tired, achy back when you're on your feet a long time, the lower right picture is what's called static back. You put your legs up on the couch or the coffee table or the ottoman, and you just let that low back relax, and it's going to melt into the floor. That's a great strategy after a long practice session or a long round of golf or 2 or 3 days in a row, as opposed to just going back to the hotel, sitting with bad posture for dinner, and then wondering why at your 7:30 tea time the next morning you could barely take the club back. It's all about having a plan. All right. This is not a neutral pelvis. This was actually one of our patients in Loveland that had hip and I think some back pain. Can you guys see, we're looking from the front. Can you see how that left pelvic bone is higher? Okay, remember my pair of sunglasses? What do you see down here? That's twisting. Here's the center of her pelvis. That's what's called the pubic symphysis, right in the center. That ought to be lined up with the spine. That's a problem. And if she were a golfer, I can't remember if it was Emily's patient, if she was a golfer or not, that's going to cause some serious complications. So we would like to see that get back to neutral. Just like your car, I want that frame aligned and neutral. Prevention strategies. Getting proper fitting clubs, guys. So many people do that now. It's really a slick deal. Getting the length, the lie angle, so that we get a good spine angle. Proper shafts, the golf bag. I'd rather see, remember the old golf bags were only one shoulder. We carried them around. Puts an asymmetrical torque on us. Push versus pull cart. I don't know if you guys have done this, but trying to pull a cart back here is way different than walking a cart going forward. I like that one in front where I can walk it. Some of you would do better to walk. You can still take the cart, but maybe from 100, 150 yards in, let the partner drive it up to the green, and you walk. Other people would do better to ride and not be on their feet as much. It varies. 101. I always think, if I'm going to go look at real estate, I ought to find a professional guy at real estate. Pretty simple. If I'm trying to learn how to swim more efficiently, I should get an instructor. From a physical therapist, what you're looking for is somebody that not only understands specific exercise and somebody that is willing to teach you, not just treat you, but really somebody that understands golf and golf biomechanics. That's important. Again, there's the customize. Now here's the carrot that I have over all of you. If you had a pain injury and I brought you in and you had to do rehab on your shoulder or your knee or your back, what I'm going to sucker you in is that carrot of golf. Because if I take away golf for most of you, that's a pretty serious deal. And so I can kind of use that, we can use that as leverage to get what we need. And you're going to find that I have a guy right now that he ruptured a disc in his neck, severe debilitating pain down his arm, had to have surgery. But in the process, he realized how bad he felt once the nerve pain was gone throughout his back. He just hit a large bucket of balls and then did a small bucket of balls a few weeks ago. And he goes, I had no idea what it was like to feel good. I thought I would just have to go to the medicine cabinet after every round. So he's bought into that, and guess what's happening to his swing now that he has some mobility? He's starting to hit it better. Here's a body strategy. I showed you that pelvis that was off. We'd rather see that in neutral because your performance to rotate is going to be better. 20 minutes before I came in here, I got off the phone with my sister-in-law who had torn her ACL 10 years ago, had it repaired. She's now doing a kickboxing class, and she tweaked her knee. Because her hips are off, she doesn't have rotation in her hips to one direction. That torque's got to go somewhere. Guess where it went? Right back to the old knee. So she's going to get a neutral pelvis here in a few weeks. Everybody heard the word core strength, right? That's a buzzword. Okay, where's your core at? Just point to it. Where's the core? Okay, where does it stop? It doesn't stop. It's a whole chain of activities. We call the hips core. Huge power generator. So we're probably talking core maybe from about mid-thigh up to probably rib cage and intertwining those, and that's really a key element. It's not just the abs. Flexibility, like those